Effective trauma-informed practice requires seamless integration of the skills and principles discussed throughout this unit. Practitioners must move beyond mechanical application of techniques to embodying trauma-informed values in all interactions with clients. This integration involves recognizing how cultural humility enhances rapport building, how active listening informs crisis intervention, and how ethical frameworks guide boundary management in volatile settings. The most effective trauma-informed practitioners develop what might be called therapeutic presence, a way of being with clients that communicates safety, respect, curiosity, and compassion while maintaining appropriate professional boundaries. This integrated approach recognizes that trauma recovery typically occurs through relationship, making the therapeutic alliance itself a central mechanism of change. Practitioners should regularly reflect on their work through multiple lenses. Are they applying skills effectively? Are they maintaining trauma-informed principles? Are they practicing cultural humility? Are they upholding ethical standards? This multidimensional reflection, ideally supported through regular supervision or consultation, helps ensure comprehensive, client-centered care that addresses the complex needs of trauma survivors while respecting their autonomy and cultural contexts. Working with trauma survivors, particularly in volatile settings, carries significant emotional risks for practitioners, including vicarious trauma, compassion fatigue, and burnout. Organizational and individual commitment to staff well-being represents an ethical imperative and practical necessity for sustainable trauma-informed care. Organizations should implement systemic supports including reasonable workloads, regular supervision, opportunities for peer support, and clear policies addressing secondary trauma. Cultural humility principles extend to organizational practices that value diverse staff experiences and create inclusive environments where all team members feel respected and supported. At the individual level, practitioners must develop sustainable self-care practices that address physical, emotional, relational, and spiritual dimensions of well-being. This includes setting appropriate boundaries between professional and personal life, engaging in regular reflective practice, maintaining supportive relationships, and pursuing meaningful activities outside work. Recognizing signs of compassion fatigue or vicarious trauma, such as emotional exhaustion, cynicism, reduced effectiveness, or intrusive thoughts about clients' trauma, allows for early intervention. The processes of reflection, deep engagement, and self-critique embedded in cultural humility can help organizations recognize the importance of self-care and address staff burnout proactively. This unit has explored the integration of core counseling skills with trauma-informed principles and cultural humility, creating a comprehensive framework for effective, ethical practice with trauma survivors. The journey begins with understanding trauma's pervasive impacts and recognizing how cultural contexts shape trauma experiences and recovery. Developing proficiency in active listening, empathic engagement, and rapport building establishes the therapeutic foundation necessary for trauma work.
Mastering crisis intervention skills and psychological first aid prepares practitioners to respond effectively in acute situations while maintaining trauma-informed principles.
Ethical practice in volatile settings requires particular attention to boundaries, confidentiality, and informed consent, with special consideration for how these standard ethical components apply when working with vulnerable trauma survivors. Throughout this work, practitioners must maintain commitment to their own well-being through sustainable self-care practices, recognizing that caring for others requires careful attention to one's own physical, emotional, and professional needs. By integrating these skills, principles, and practices, mental health professionals can provide compassionate, effective support that honors trauma survivors' resilience while facilitating healing and recovery.